So today we are going to talk about cardiovascular collapse and sudden death. So this is a type of an emergency which will occur anyone, any place, anytime. Okay. So basically this emergency need emergency care or ICU care. Okay. With complete focus on the patient. Okay. So and basically it needs basic emergency, then only the person can be survived. Okay, so basically the cardiovascular or we call heart attack or heart sudden collapsing of the heart. Okay, all these terms can use. So basically here we are using cardiovascular collapse, sudden stoppage of the heart. Okay, so in this condition we need medical emergency, but before to reach the treatment spot, okay, to reach the treatment spot, we have to do basic things to survive the patient. Okay. So basically we can learn all those things here. What are the things are there? So this is the cardiovascular collapse or death will happen mostly nowadays after the post-COVID, who are suffered from the COVID or who took COVID vaccines. It may be, it may not. What is the reason? We don't know, but the cases we are going to see or we saw. So most of the patients who suffered from the COVID are died. Okay. So what are the cause of cardiovascular collapse or sudden death? So basically, it is the stoppage of the heart due to the stoppage of the circulation to the heart. So heart need its own circulation. So already we studied in for physiology and anatomy. So it have arteries which supply the blood to the heart muscles. Then only the heart pumps, contraction and relaxation will happen. Systolic, diastolic, systolic, diastolic. So contraction, relaxation will happen. So what will have, would have the structure of the heart is upper have art ventricles and artericles. Okay. So this is the shape of the heart. Okay. Example. There are four chambers we have. Right atrium, left atrium, right ventricle, left ventricle. So first atrium will contract, then ventricle is relaxed. When atrium is relaxed, ventricle contracts. So this sequence have to be gone continuously. But in this problem, what will happen? Mostly the ventricle fibrillation will happen. Ventricles doesn't contract properly. Okay, because of the poor circulation of ventricle muscles. Okay, because of the poor circulations of ventricle muscles. So what will happen? The heart cannot pump the blood properly to the body, mostly oxygenated blood and the deoxygenated blood, both. It cannot pump the blood to the lungs. It cannot pump to the blood to the whole part of the body. So what will happen? So the heart cannot get the blood itself. This is the main thing. If other organs cannot get blood, we will have the time. One, two, three. Every organ have different times, different timing. Okay, but heart doesn't have time. If it stops, what will happen? The circulation to the brain will stop immediately and brain death will happen. So because everything is connected to the brain, so brain death will happen. So body will collapse. Okay. So we have 3 to 4 minutes only, or sometimes 4 to 6 minutes. Okay. 4 to 6 minutes, or mostly I will have, we can tell 3 minutes. 3 minutes we have need to survive the patient. So that's the reason the American Heart Association or other research centers have planned two types of support. What are they? Two types of support. Basically, one is BLS, basic life support. So whenever you saw the patient having this problem, or he have pain, cardiac pain, unable to breathe, suddenly he is going to collapse. Okay, all this thing will happen. So what you have to do as a person, basic life support, you have to do the do to the patient till he reach to the center, expert center or hospital. Okay, so these are the things we have to do. In the basic life support, first of all, what do you do? We have to call emergency. Like in our state, we have 108. In other state, it may be another number. So we have to remember the number. Okay, emergency number. Okay, so this is the first thing. And the second thing is that what you have to check the pulse. Within the 2 to 3 seconds, you have to check the pulse. Mostly keratoid pulse. If the pulse are there, so what you have to do? The person is having the breathing or not. Just checking the pulse and checking the respiration. Within the 2 to 3 seconds, this is very, very important. Okay. Okay. Next, you have to start CPR. Next, you have to start. This is the CPR method. Whenever a person is collapsed, so you have to make the comfortable like this or this type. You have to put on the sternum bone. Okay, sternum, middle of the sternum, not upper part, not lower part, mid of the sternum. Okay, above the Ziph sternum. Okay, this is the center of the chest. You have to give pressure. So here in the uh, updated guidelines, there is a slightly changed, but here we are talking in this book. So here we have to give chest compression, 100 to 120 per minute without interruption. So we have to give 100 to 120 times per minute. Okay. So what we have to divide this with 3 cycles. 30 seconds will do, and we will perform. We have to give the mouth to mouth air. Okay, mouth to mouth air. Or so first you have to hold like this, like this. This is in this diagram. They are explaining how to hold the patient. So you have to hold, and you have to give the mouth to mouth air. Or someone have the pocket air, they will put that and they will give the uh, air to the patient. So you are giving the air and you are pressing the chest for 30 times, and you are giving mouth to mouth 2 times. Then you are pressing. So you have to continue till 1 minute. This is the first. Okay. First thing. Next, here we have to do next in advanced life support. This is the basic life support, CPR, mouth to mouth, giving air. This is the basic life support. They are much more detailed, but here we are not going in the detail. Here we are understanding what we have to do and what are the types, because it is a different course. There is 2 to 3 days course for basic life support and advanced life support. Okay, advanced life support and basic life support. So here we are just step by step what we can do at the time of the condition. So we are learning that. Okay. So basically, till that time, you have 2 to 3 minutes, you are giving the CPR, you are trying to regain the heart ability, and you're giving the air to the body. So at that time, before doing that, you have to call, or you have, if any person is falling down, we are going to have cardiac arrest. So you have to call for help. First thing, please come. He's collapsing. So at the time, you have to tell, you or another person decide to call. So you are going to call, and he will take care the rest of the patient procedure. Okay. So here, what we have to giving CPR and mouth to mouth air. Next, till that time, the advanced life support came or emergency came. So at that time, what will they do? They will have this protocol. This is the protocol is having that they are the chest compression, and they have shock. Then they will use shock on the shock. Okay. Next again, they will start IV line injections. Okay, mostly epinephrine. Epinephrine will be given 1 mg every 3 to 5 minutes. And then again shock. Then injection, then shock. Then if patient cannot rescue, or he open his eyes, or he regain the consciousness, if not happen, after that they will give amiodarone 300 mg. Then we have to give the shock. Sorry, you have to give the CPR, then shock. After that, if anything happen, okay, he rescued or not, then after they will start this therapy. Okay. Specific therapy, this will be designed by the cardiologist, emergency cardiologist, or emergency doctors who are there present at the time. Okay, so basically, initially, what you're doing, you're calling for the help. Okay. And calling to the 108 or any number for emergency, and you are giving the CPR. Okay. And mouth to mouth air. Then after that, if the advanced life support came, they what they do, they will do the shock. Okay, then after the epinephrine injection every 2 to 3 to 5 minutes. Then if patient is not recovered, then again amiodarone they will give the CPR, then shock. Then till that time, cardio emergency doctor will come, and he will advise any specific therapy to rescue the patient. Okay, so this is the basic thing we have to know that. Okay, so what are the causes? Let's talk about that. Different types of causes: cardiac and sudden cardiac death. What are the reasons? So coronary artery disease means the coronary artery is damaged. It is filled with the atherosclerosis or fat. Okay, then the blood is not reaching to the heart properly. Okay, this is one of the reason. Second is cardiomyopathies. Cardiomyopathies means different types of cardiac diseases, like this is dilated heart or hypertrophic tropic heart. Okay, when any leakage of the blood in the right ventricle mostly. So these are the reasons. And inflammatory condition, any infection to the heart or valves. So we have tricuspid, bicuspid, okay, pulmonary. Okay, these are the valves. It may be get damaged. So that's the reason blood will come outflow, and it will give the stress to the heart. Anything will happen. Electropsychological abnormalities. So it is from the brain, any issues. Okay, or inherited disorders. Okay, congenital heart disease, ventricle tachycardia, by birth, congenital disorders. Okay, or inheritary from the family members. Okay, so these are the reasons you can see in the sudden collapse or shock. Okay, some other reasons are also there. Transient ischemia means sometimes a patient have mild heart attack that can happen to anyone to trigger the function of the heart will Sometimes it good, sometimes it very not good. It will damage the heart muscles, but sometimes it is good to improve the function of the heart. Small heart attack will come. That is transient ischemia. Okay, and second, it may be other conditions like low cardiac output, mean the heart unable to pump the minimum amount of output. It may be the reason, or any electrolyte imbalance like sodium, potassium, calcium, magnesium, anything will happen. Okay, or low amount of oxygen. Is any issues in the lungs, like in COVID-19? The COVID-19 coronavirus, what is doing that? Damaging the epithelial lining of the lungs. So there's the reason it cannot enter, oxygen cannot enter into the lungs and it is not reaching to the blood vessels. So what will happen? Then the oxygenated blood is not getting to the heart. So heart is going to die. Okay. So this is happening in the hypoxemia. Acidosis, high amount of acidic in the body is one of the reason. And neurological issues, any damage to the respiratory centers, okay, of any drugs, toxic substance patient taken, okay, due to the toxicity, the heart or brain nerves damage. So then the sudden cardiac action will happen. So, okay, so these are the reasons the patient will have cardiac arrest and shock. So it is depend upon the condition to treat the patient in only medical emergency. So basically in the electrohomeopathy, what we can do, we can we cannot advise anything, but we can apply BE to this area, okay, to activate the heart, or sometimes RE also can be applied to the heart, okay, and you can give A3 orally, A3 BE or A1 PE to improve the circulation to the heart region. Okay. After emergency completed, you can treat the patient. Okay. We will discuss in cardiovascular diseases. In that we can use the electrohomeopathy remedies. But here we have to take emergency medicine. Okay. To protect the patient. So I hope you understood about cardiovascular collapse and sudden death, why it happens, and what we have to do. Okay, in initial condition, we learn today. So if any doubts, kindly ask.